Hi guys, today I'll show you how to tie your shoes correctly. I'm kidding, but not quite. Today we're going to learn how to hip hinge correctly, how to use our glutes and hamstrings and not our lower back like that. Let's get started. Hi, I'm Nick Zenkov, and today we're not just going to talk about the hip hinge. We'll talk about the bending forward. Is it safe? Is it bad? We're going to talk about how correctly to do the hip hinge, and of course some tips and tricks to do them as perfect as possible. Normally, people are bending from the lower back. They're using their QL muscles and erectors spinae. They are lacking of glute strength and of course mobility in the hamstring. That once, 2 times, or some millions of times isn't the problem. The research, the science is saying bending forward isn't the problem. What then? Why we are talking about that? Why I'm telling you make hip hinge, not bending forward? Because the problem is chronic, it's long term. Normally people average are bending about 3,000 times a day. That means million times per year. A lot of bending. And of course, nothing will be changed in a few bendings, even with weights. It's safe, but that has to be about 10% of your bending. Normally you have to use the big muscles, the engines, the glutes and the hamstrings. The glutes are about 5 times bigger than the QL muscles. They have to lift the heavy shit, not your lower back, those little muscles at your back. They're made for stabilization. That means that yes, they can bend, they can compensate the lack of the glutes, but for how long? For some people, a year is enough. For others, even 30 years won't be a problem. But do you want to take the risk? Why just make it better and be healthy to the rest of your life? Not the other way around, to be scared every day. If you bend, what will happen? When you bend forward, you're extending the spine. Your posture is a crap. And of course, the other way around, when you rotate the hips, when you make a anterior pelvic tilt and your hips are straight, when you squeeze the abs, squeeze the back and tuck the chin, you are straight. In that movement, you use only the glutes and the hamstrings to the way up. And that's the most important thing. How you can make that perfect hip hinge. Normally, people lack of hamstrings mobility, and you can test it very easily. Just lay on the floor, extend both of your knees, and lift one of them. Don't flex the knees, make them as extended as possible. How many degrees can you reach? Can you reach 90? That's the goal, to reach 90 degrees. That means when you go to a hip hinge, you can be horizontal to the floor. If you lack that mobility, normally most people it's about 75 degrees. That means the hip hinge will lack mobility. The more stiff are your hamstrings, the more your lower back needs to compensate and round. Of course, I got you covered. Here are 3 exercises, really easy ones, to fix that hamstring tightness. But of course, how to make it? First, the feet and the knees. The feet are pointing straight and the knees outside. Normally with people the knees are pointing inside. That means lack of glute activation, so rotate them outside. That's the first thing. About the hips, check it. Anterior, posterior pelvic tilt. Find the neutral, and then the only thing you need to do is go back. How to make it? Just find a wall and test it. Go, let's say, 1 step ahead and try to reach the wall. Okay, make a little step forward. Try again. And little by little, you'll get full range of motion till you reach 90 degrees. But is that the only thing you need to do? Of course not. You need to have ab activation and think about your head and the shoulders. Every movement that you're doing, it's a whole body movement. You need to think for every part of the body. I have one more tip for you. Using a stick, it needs to touch 3 points: your head, your mid-back, and the bone just above the glutes. Just take it with both hands and try to do a hip hinge. If you're rounding forward, at least 1 or 2 points will be in the air. The stick needs to touch constantly those 3 points. And of course, if you are not lacking any mobility, it will be the perfect one. Just go down and forward. I hope I helped you about the hip hinge or the RDL in the fitness world. That's one of the most important movements that you need to master. I was Nick Zeko, and if you need my help, I'm down in the comments. Till next time.